let me just give you this.
Give me the whole folder.
Whole thing.
Make sure it's
All right.
Great. Okay, you're on, Fran.
Thank you so much. Good afternoon, everyone, and thank you for joining us. My name is Fran Spreer-Albert. I am the Chief Operating Officer and Chief Financial Officer here at Albany Med. I speak on behalf of our President and CEO, Dr. Dennis McKenna, as well as our entire workforce in welcoming Senator Chuck Schumer here with us today. As Senate Majority Leader and as New York's senior senator, Senator Schumer works tirelessly advocating for our state and for our nation. He joins us today to announce an initiative that will lower the cost of a drug used by many of our patients, in particular our youngest patients, and they depend on that drug to thrive. So with that, I am very pleased to announce Senator Schumer.
Thank you. Thank you very much, Fran, and I appreciate you and all the good work that Albany Medical Center does, and I want to thank them from the CEO and COO to the doctors and nurses and techs and administrators, all the way down to the people who keep the floors clean late at night, keep the place clean. It's an amazing institution in the Capital Region. We're lucky to have such an outstanding institution of health care, and as you know, I'm always providing help for you, and I appreciate that.
We appreciate you.
And we're also joined today by Linda Riddick. She is the Professor of Pediatrics and head of the Pediatric Endocrinology Center at Albany. We also have Nancy Jones, who's a nurse.
Nurse educator.
A nurse educator in this area. And we have Molly Skinner and Danielle Slater, both of whom have diabetes and are going to talk a little bit after me. And Coretta Killikelly. Is she here? There you are. Snuck in. Coretta Killikelly, a registered nurse. So why are we here? We're here because this little bottle is a crisis. You wouldn't think so. But this is insulin. And insulin is vital to huge numbers of people here in the Capital Region and New York. And it has become so expensive that many, many people who desperately need this life-saving medicine, insulin, can't afford it. The price of insulin is going up and up and up. And the average and the cost that many have to pay is $600 now a month for this insulin. When you add that to the other materials that diabetics need, the pumps and all that other stuff, the measuring stuff, it can cost, as this little chart shows, about $13,000 a year if you don't have insurance. And very much close to that if you have junkie insurance that has high deductibles, high co-payments, and things like that. That is the fundamental reason we're here. This innocent little bottle, which is a lifesaver, is a crisis because of its outrageous cost. Here's the amazing thing about insulin. This is not a patented drug, you know, where you have to go pay the pharmaceutical company money for all their research and investment. It was invented in 1921 by a Canadian doctor whose name was Alexander Fleming. And he was such a decent man that he donated all the research for $1. So, you know, you hear, well, you got to pay a lot for these medicines because there's a patent and you have to pay for the cost of development. Not here. The reason the cost is so high is the outrageously convoluted system with the pharmaceutical companies and the distributors of these drugs, who pay far more attention to their own profitability than to helping people like Ms. Skinner and Ms. Slater, who are here. Well, we're here to change it. Today, I am, as Majority Leader, telling here folks in the Capital Region and around the country that we have introduced new legislation called the Affordable Insulin Now Act by Senator Warnock. And one of the powers, as Majority Leader, you don't have complete power, as we have learned with a 50-50 vote. But one of the powers I have is to determine what goes on the floor of the Senate. That's the power of the majority leader. And today I'm telling folks in this community that my intention is to put this on the floor of the Senate in March and have a vote. And because this bill has bipartisan support, unlike the partisan nature of so many things in Washington, we have a very decent chance of getting it done, which will cause many to breathe a sigh of relief. Diabetes is a very, very serious illness. 1.7 million New Yorkers have diabetes. 450,000 have it but don't know it. So that's over 2 million. 10% of the population in most regions has diabetes. And actually, death rates from diabetes are going up. It's third in the country. Cancer is higher, but their death rate is going down. And heart disease and circulatory ailments is higher, but theirs is going down. But diabetes is going up. And now 1 in 4 people who have diabetes ration their insulin because they can't afford it. When you ration your insulin, that causes serious problems, because if you don't treat diabetes or have enough insulin, it can result in blindness, in amputation, and eventually you don't survive. And we know of many instances in New York State where people have died because they couldn't afford the insulin. It's a life and death situation. So, let me just go over some more numbers here. In Albany County, it's estimated 7.9% of adults are diagnosed with diabetes. In Rensselaer County, 8.7% have diabetes. In Saratoga County, 7.8% have diabetes. And in Schenectady County, 9.5% have diabetes. Well, you add up the family members, the brothers and sisters and children and parents, it affects probably close to 1 in 4 people here in the capital region. So that's why this is so important. And the American Diabetes Association estimates that 1 in 4 healthcare dollars are spent on diabetes. So we have a real shot to fix this. I am aiming to do that in March, and hopefully it will bring some real relief. Our act says the most you can pay a month for your insulin is $35 a month. Instead of the $600 that so many people are paying, $35 a month. The drug companies will still make some money, but not such outlandish money that people can't afford it. And the $35 is what it should be, what it was 10 or 12 years ago. The cost of the cost of insulin goes up about 15 to 20% each year. So it's going to get higher if we don't do anything, and more people will suffer. So that's basically it. And now let me call on Dr. Reddick, who can give you some more of the details. Unlike me, she is a doctor. Thank you, Dr. Reddick.
Thank you. Thank you, Senator Schumer. We are grateful for your efforts on this critical issue, and we know what a difference it will make to have access to affordable insulin in the lives of the patients that we care for, their families, and in the health of the community at large. Children with diabetes need insulin in order to live, but for too many families, the skyrocketing out-of-pocket costs make it difficult for them to obtain this medication, even when they have insurance. It is even more hardship for those who have a high copay or they have a high deductible. Also, insurance companies only cover insulin for 1 month, a certain amount of insulin just for 1 month. They will not cover replacement insulin vials. Parents have come to us distraught when a vial has dropped or when a vial is lost. This can mean hundreds of dollars out-of-pocket expense for these families that is not covered by insurance. Capping the out-of-pocket cost of insulin is an important step toward providing families with some financial relief. and in helping to ensure that everyone who needs this life-saving medication is able to access it. Thank you, Senator Schumer, for your work to reduce the cost of insulin and to help make this life-saving insulin and this life-saving treatment more accessible to all.
Thank you, Dr. Rich. Okay. Next, we're going to have Molly Skinner, who's a person with diabetes. She lives in Schenectady County.
Thank you, Senator Schumer. My name's Molly Skinner. I have type 1 diabetes, and I have had type 1 diabetes since I was 2 for about 23 years. You can do the math. Insulin has consistently, without a break, every single day of my life been a necessity. I luckily, since I'm 25, I've had the benefit of my mother's insurance, but since I am turning 26 this year, this is a very, very vital thing to happen for people my age, people with diabetes, type 1, type 2. Anyone with type 1, if they drop a bottle of insulin, they're in bad straits because insulin is fragile. It's sensitive to temperature. I keep my insulin in a cooler in my purse 365 days a year. There's a lot of parts of diabetes that people don't even know that you deal with when you have diabetes. So this is really, really a big deal. It shouldn't be put food on the table or insulin in my body because this is a life-saving drug. This is a drug that we need to stay alive. It's not an option. It's not anything that we did. In the case of type 1, we are completely not at fault, and the insulin keeps us alive. So it's extremely, extremely important. And not to mention all the other costs of our insulin pumps, our, pen tips, test kits, sensor accessories, you could call them. There's a lot of expenses, and this would be a huge one that we could take down, thankfully, with the help of Senator Schumer. And I really hope that we can get this done. So thank you all so much for being here, and thank you so much, Senator Schumer.
Thank you, Molly. Well done. And now we have Danielle Slater. She is from Albany County.
Yeah, born and raised Albanian.
City.
Yeah. Thank you so much for being here. Yeah, so I've had diabetes for about 29 years now, and one thing I just want to hammer home is with type 1 diabetes, it's not a choice, right? It's an autoimmune disease. There's nothing I can do to cure it, to prevent it, or worry about my kids getting it. And I shouldn't have to make the choice whether or not to feed my family or pay for my insulin. And the truth with insulin is, it is a prescribed dose. It doesn't really help me or help others if you don't take your prescribed dose. So you have people who are rationing insulin just to get by, just to do whatever they can to stay out of the hospital, but then those people risk serious life-threatening complications. And then so what's now? Do you pay now or do you pay later? Do you pay your $600 a vial now and get the medicine you need just to, again, pay it next month? Or do you, God forbid, have to pay thousands of dollars later for a wheelchair because both of your legs got amputated, or for dialysis because now your kidneys don't work? So I just want to thank you so much. It's of vital importance, and it's a non-political issue. It's an American issue. You know, they say people with diabetes make 180 decisions each day based on their diabetes alone, right? Like, is my blood sugar high? Is my blood sugar low? Is there going to be food where I'm going? Do I have everything I need? Is my prescription ready to be picked up? Let's not make whether or not we take our insulin 181. I got enough stuff going on. We all do, right? We don't need another decision in our lives. So I want to thank you so much for your support again, and I look forward to a cheaper copay.
Thank you very much. Okay, I think that's our scheduled speakers. Anyone else?
Ms. Coretta.
Oh, yes, excuse me. Coretta Kilkenny is a nurse in Albany who's experienced, has lots of people she takes care of with diabetes. Thank you.
Good afternoon, everyone. My name is Coretta Kilkenny. I am the founder and executive director of Health Advocate not-for-profit organization, CEKRN Consulting Incorporated. We are located in the heart of the picturesque downtown Albany at the Blake Annex, home of the United Way of the Greater Capital Region, led by Peter Gannon. I'd like to thank, let me get my glasses, that would be helpful. I'd like to acknowledge all the dignitaries and elected officials here today and our other invited guests, especially Senator Schumer,
Thank you.
for making this insulin cost cap bill a priority. The bill will improve the quality of life and self-efficacy for individuals living with diabetes and the cost of visiting the ER versus managing their chronic illnesses. I would also like to acknowledge Dr. McKenna or his representative and all the healthcare workers today, and thank you all for all you do. COVID-19 has preyed on underlying chronic health conditions such as diabetes and mental health, which unfortunately are standard disease states in the Black and brown community. Research has shown that leaving these conditions unmanaged will lead to long-term effects on the community's health and well-being. At CEKRN Consulting, we serve members of the community who are affected by these chronic illnesses. Our clients tell us that it is difficult to understand and manage their disease or not knowing what questions to ask at medical appointments. On the top of their list of concerns is a lack of ability to afford their medications. To address some of these concerns, we accompany clients to or meet them at their appointments to help them understand their treatment plan. We bridge the gap between patient and provider by breaking down medical jargon into plain language and by asking questions that elicit clear communication between the client and their provider. Our services include assessing for social determinants of health and making the necessary referrals associated with our findings, care coordination, health coaching, assisting with SNAP and HEAP applications. 1 in 3 of our clients are diagnosed with type 2 diabetes, and even though most are insured either with Medicaid or Medicare, clients tell us that they still struggle with payment for their medications. Medications, if not taken, can and will have adverse outcomes. Imagine having to choose between paying for your medication or paying for food or utilities. This is the reality for our client population. Just recently, a client was referred to CEK for health coaching from a community-based organization. At the intake, we discovered that the client had been diagnosed with type 2 diabetes, hypertension, and peripheral vascular disease. The client stated that he passed out at a family function and had to be taken to the ER for treatment where he was stabilized. After spending a few days in the hospital, the client was discharged with 9 prescriptions, 3 referrals for specialists, and an appointment to see his primary care doc. He states that he's not seen his primary doctor in many years. The client disclosed that he had gone to the ER at least 8 times within the past 6 months, and that the thought of managing his chronic illness by himself was overwhelming. As a result, he did not follow the hospital's discharge instructions, nor did he fill the prescription because he could not afford it, because he's retired and he's on a fixed income of $1,700 per month. A 30-day supply of his oral diabetes medication alone would cost him $200 per month. Insulin would be an additional $200 to $600 per vial. The Healthcare Cost Institute estimated the average price for a 40-day supply of insulin has gone up from $344 to $666, almost doubling in cost. His plan for treating his chronic illnesses is to go to the ER. When he feels ill, where he will be stabilized, then discharge, and in a few months, the cycle continues. Unfortunately, this is the consensus for majority of our clients. This is not a solution. This practice is a recipe for disaster and negative impacts on many levels. A decrease in the quality of life for this individual, the cost associated with caring for patients who are readmitted for unmanaged chronic illnesses such as diabetes. One solution that would remedy this situation is to make medications more affordable for all. This bill to cap monthly out-of-pocket insulin costs is a step in the right direction for correcting the disparities among clients living with diabetes. We are confident that it will have a positive effect on the entire region. Thank you for the opportunity to share our lived experiences, and thank you for your time.
Thank you. One thing that Nurse Kilkenny brings about, this will actually save the healthcare system money at the end of the day. Because when people take their medications, the greater complications, whether it's kidney or vascular or eye, that cost much more money, will no longer come about. Okay? So we'll take questions on this subject.
So for the modality for regulating the cost, is this only going to be done through insurance companies, or is this
Medicare, Medicaid, insurance companies, it's a $35 out-of-pocket cost, period.
So about the uninsured, is there anything that can be done to help them, because diabetes wouldn't discriminate?
Yes, we'd like to, most of the uninsured would have Medicaid, and these days with ACA, many, many more of them get insurance. So almost most people would be affected by this.
And when you talk about bipartisan support, how have you been able to measure that? Does it seem like near unanimous?
No, I don't think it's near unanimous. We have a lot of our friends who don't want to pay for any kind of health care, but there are several Republican bills that have been introduced that are similar. I believe one by Senator Kennedy of Louisiana and one by Senator Collins of Maine.
And how do you convince those that are not on board yet with their
Well,
policy?
A, the humanity, B, the necessity, and C, it'll save money. Okay? Yes.
Yes. As a diabetic myself, one question I have is, in addition to like insulin, there's a lot of other expenses that diabetics, including myself and some of the other guests you have up there, have to deal with, like insulin pumps
Yes.
or blood sugar things. Could this possibly be the start of some of
Yes.
that kind
This
of
is
happening
not.
to other
This
things?
is yes. This is not the end. This is the beginning. It's very important because the insulin prices have gone up, and probably insulin itself is the greatest expense. But certainly we will look at other expenses as well.
So it could spread to other
Yes, other things that
diabetics need.
people who have diabetes need. Absolutely.
Thank you.
Okay? All righty. Now that we did have an off-topic that people had asked on Ukraine, so you want me to say something on that?
Yes, if you want to start with the reaction, and then I had some specific questions.
Okay. Well, here's what I'd say. Look, first, the president has the ability.
Thank you so much.
Thank you. Okay. So the president has the ability to impose swift, strong, effective sanctions, and I believe he's using them appropriately. Okay?
Thank you. As for the questions, are conversations happening, or will they happen at the state level about Ukrainian refugees coming to the U.S. if needed, and what would that look like?
Well, I'm sure there will be such discussions. They haven't started yet, but it's something that people would certainly look at, yes.
And what resources could New York State put forth to help?
That I can't. You'd have to ask the state that.
Okay. Thank you.
Okay? Thank you, everybody. Have a nice day.